Hello and welcome. My name is Luke Herbert. I am the Director of Pharmacy at KSB Hospital, and with me today is Gabe Billiet, Pharmacist, KSB Hospital. Glad to have you here today, Gabe, and we are going to talk about how to safely use pain medications, and in particular, how to use pain medications for like short-term use or acute pain use, and not so much chronic pain, as that's a bit different. So, Gabe, why are we talking about pain medications in particular?
Well, in this country right now, and for the past 20 some years, we've been in what we call an opioid epidemic. Over those 21 years or so, we've currently lost approximately 760,000 people to drug overdoses, whether it's from prescription medications or heroin.
And this slide has a lot on it, Gabe. What's the takeaway from this slide?
Sure. Well, what the slide basically shows is that the majority of people, over 50%, when it comes to misusing a prescription medication, they get that medication from a friend, family, loved one, versus getting it for themselves or even buying it on the street from a dealer.
So it kind of paints a picture, it tells a story a little bit of an all too common occurrence where somebody, gets a very well-intended prescription from a provider for a procedure. They maybe don't use everything in the prescription bottle, and some of that winds up sitting in a medicine cabinet. And they, or sometimes it's lent to a friend or a relative, or somebody just takes it upon themselves to borrow prescription pain meds out of a pain medicine cabinet, and we wind up with the kind of the situation that is basically the opiate epidemic that we're dealing with. And so going back, 20 years, we treated pain, differently than we're thinking about it now to some extent. And we were very aggressive and proactive in trying to make sure our patients had zero pain when possible. We actually referred to pain as the fifth vital sign. And at the same time, we were marketing, or pharmaceutical companies were marketing a lot of newer pain medications, sometimes better tolerated pain medications, and opiates, strong pain medications really became the center of pain management. And so we're starting to, look at that a bit differently. A couple studies, that we're starting to look at now, one here reflects that 9 out of 10 patients, out of 50,000 patients who had a surgery, 9 out of 10 reported that their pain was basically mild or gone within 4 days. So that's taught us a bit about, how much pain medication is really necessary and what is the right number of doses to be prescribing for different kinds of procedures. And then the second study referred to here is about minor hand or wrist procedures, like a carpal tunnel procedure, and where an average of 30 doses were prescribed. But almost half the patients used only 5 or less doses. And on average, there were about 20 doses left over in a medicine cabinet when the patient was done with it. And then a couple other studies, Gabe.
Well, there were some recent studies that have looked at using non-opioid medications versus opioids. Ibuprofen was showed to provide as much pain relieving properties to it as oxycodone, 5 milligrams was for a minor procedure. And so that's what we need to kind of be looking at is opioids versus non-opioids, for these less invasive procedures, while we can still provide the same pain control with that.
Absolutely. And there's a number of studies out there that have compared after minor procedures, patients that were given an opioid prescription or a strong narcotic prescription for pain, and also some patients that were given, just ibuprofen or other anti-inflammatory non-narcotic medications. And in many of the studies, the patients who didn't have opioids or didn't have opioids prescribed did just as well. And also part of that conversation is that a lot of patients that did have opiates prescribed were continuing to use opiates 90 days later and even a year later in some cases. So Gabe, what are the main goals of pain control?
Really, we look at 3 things that we really want to focus on. 1 is we want to minimize the patient's pain. 2, we want to keep that patient moving. And 3, we want to help them heal. All of those things kind of feed in together for our ultimate goal, which is to return the patient back to as normal of a life as they can be.
Perfect. And we're going to talk a little bit about treatment plans here. So, what is a treatment plan and why is a treatment plan important?
Sure. Probably the biggest key to it is we want patients to develop realistic expectations and goals. And that has to do with the degree, of the injury or of the procedure, the duration, of it, how long is it going to take them to recuperate, recover from that, as well as, a realistic expectation of how we're going to reduce that pain and to what level we're going to reduce it. Again, we want to focus on the fact that we want to get people back on their feet, back to normal as quickly as possible. So as those things will kind of let us kind of dial in with that conversation with the doctor. And then we can also kind of focus on education, as well, pain management, treatment options and the safe use of opioids if they're needed.
So we've kind of thrown around that word opiates or opioids. What exactly are we talking about when we refer to opioids?
Oh, sure. Those can be, it's a whole class of medications. They include the morphines, the oxycodones, hydromorphones, even newer medications such as tramadol are in that same kind of family, that same classification. And heroin is even an opioid as well. In fact, any prescription medication that has a potential to cause addiction, we lump those in as like a scheduled type medication.
Perfect. So, and then in contrast, we also have non-opiate pain medications and other therapies that can be used for pain.
Sure. Those would be our anti-inflammatories, our NSAIDs, like ibuprofen, Aleve, naproxen, our prescription anti-inflammatories like Celebrex or meloxicam. And then our Tylenol, acetaminophen is another category, of non-opioid pain medication. And then things like our nerve pain medications, gabapentin and amitriptyline help reduce, nerve pulses which could be causing the pain, as well as our non-medicated approaches such as like ice, things along those lines.
Perfect. And so we're going to go over a couple of kind of at a high level treatment plan. So what would be a typical treatment plan for, or what may be included in a typical treatment plan for mild pain?
Sure. I always recommend that patients start with ice and elevation. Both will reduce, inflammation at the site. Both are going to help minimize blood flow to that injured area and help kind of minimize that pain response in general. And then I always tell patients too, don't neglect rest. Sleep overall helps us minimize that pain response. Then we can also look at things that help kind of relax the body itself, meditation, soft, soothing music, and then things that are going to help kind of work those muscles and also help distract the body away from pain, such as exercise, stretching, even just generalized, slow-paced walking can be beneficial.
Perfect. And so for like a mild to moderate or more so moderate treatment plan, we may be looking at Tylenol or NSAIDs, anti-inflammatory drugs, and possibly, depending on the source of the pain or injury, nerve pain medications like Gabe mentioned earlier. So some of those things come with some level of risk. And so depending on a patient's prior history, for instance, if a patient has kidney disease, then we may need to be more cautious with NSAIDs. Or if they have liver disease, we may need to be cautious with Tylenol. But Tylenol, NSAIDs, anti-inflammatories, these are the kinds of things that we typically may use for moderate pain, where we really wouldn't need to use an opiate med at all. And kind of jumping up to severe pain, what might a treatment plan for severe pain look like?
Well, that's when we would jump to those opioid medications. We'd want to go with, medication that we can go with a low dose and a short duration. And a lot of times we will pair it up with the NSAIDs, that acetaminophen that you talked about. Studies actually do show that combination together, can increase the pain relieving properties than either one by themselves.
And typically when somebody takes acetaminophen or NSAID with an opiate, they use about half as much opiate to manage their pain just as well. So we want to talk a little bit about risks of using opiates and maybe strategies to minimize risk.
Sure. It all starts with that conversation with your prescriber. Let them know your family history. Is there anything that puts you at risk, of addiction? Family history, personal history, things along those lines. If you've had, previous opioid medications and what your response was to them. If you have any underlying health conditions, some health conditions such as brain health conditions like depression or anxiety, could potentially increase addictive behaviors. So it's all about that conversation. And keep in mind too, we always want to go with the lowest dose for the shortest duration possible with our opioid medications if they're needed at that time. So bear in mind too, we want to avoid using it with certain medications. And we want to make sure that we're maximizing that treatment plan to include other non-opioid, modalities or, therapies along with it.
Perfect. And some folks may be inclined to ask, can I wait to get my opiate prescription filled? Maybe I won't need it. So you definitely would want to talk to your prescriber or your surgeon about that. They'll have, great insight as far as like the likelihood that you'll be able to manage your pain appropriately without an opiate prescription being filled. You would also maybe want to know if there was any local anesthetic injected during the surgery that might wear off. You wouldn't want that to wear off at midnight and all of a sudden your pain triples and you don't have any pain medication on hand. And then you would definitely want to have a plan in case, you get to midnight, the first night after your surgery, and then your pain increases markedly. And if you don't have a 24-hour pharmacy or someone go to the pharmacy for you at that time of day, you would want to avoid that possible situation.
Yep.
Can we talk a little bit about the safe ways to store pain medications and all medications for that matter, and also what folks might be able to do with any leftover opioids that they don't need after a procedure?
Certainly. It all comes down to we want to limit access to it, be it from children, relatives, animals, to the medication. And so that includes keeping it up high, keeping it, safely put away, keeping it in the original container itself. When your usage of it has stopped, we want to dispose of it safely, whether it's a take back program at your local police department. Dixon is a great one. Whether it's buying one of the mailback bags from a local pharmacy, or whether it's getting rid of it the old-fashioned way in your trash. Now, if you go the trash route, do make sure that you mix it in with something that's going to make it harder for it to be pulled out of the trash. So coffee grounds, used kitty litter, something that just makes it very unappetizing for the accidental or purposeful taking of it.
Perfect. And, should I worry about addiction is a common question. So typically addiction, it would be very rare when opioids are used for 5 days or less and somebody is in severe pain. Certainly some folks are more at risk for addiction, and that's part of the conversation with your prescriber. How else would you, or what would you add to that answer to folks?
Well, sure. That 5-day window is where our pain level is the highest. In cases where you have a high level of pain, cases of euphoria or that high feeling or those intense like pleasure sensations brought on by opioids, those are minimized when that pain level is high. So by keeping that usage just to that, that window, we can minimize the risk to the patient. So keep in mind too that addiction is basically where we seek out a substance, even though we know that it's harmful either to our health, whether it's to our personal relationships along those lines. So
perfect, thank you. So to kind of wrap up our main takeaways here, you definitely want to work with your surgeon or your provider, your physician, to know your treatment plan for your pain. You want to understand what the expectations are around your pain management and make sure you get all of your questions answered during that conversation.
Yep. Keep your medications to as low dose as possible to treat the pain and as shorter duration as possible. We want to manage that pain so that you can heal, and then we want to dispose of the medication after you're done with it. And most importantly, don't share that medication with anyone besides the intended recipient.
So perfect. Thank you very much, Gabe. I enjoyed working with you on this, and thank you again to KSB Community Wellness, and everybody have a great rest of your day.
Take care.